Hi, everyone. I'm Dr. Miriam Smith, the host for Empowering New Nurses. I was asked the question. It was like this. What can you say about yourself? Or tell me about yourself. So, as we celebrate Black History Month, see me here in my regalia, and I am excited to know that I have been one of the contributors to the nursing profession for many years. So that's one of the things I would say about myself. I'm a nurse for many, many years. I'm from a background where I'm the first nurse in my family. I'm from the beautiful island of Jamaica, West Indies. And I'm passionate about nursing. My mom, you see, was such a caring person, and she has passed that on to us, on to her children. And I think being the first girl of the family, I embraced her nurturing um, capabilities or what she passed on. I've observed her from a little girl up, and she has always been that way. So that's her nature, and I've emulated her. So that's a part of my growing up experience with my mom, who would have had uh, gentian violet at home when other children, myself, or any of the neighboring children get injured in those days, she would apply. She wasn't a nurse, but she had her little way of helping and caring, and of course, administering those little herbal stuff for us. And I'm here, and others are there in different parts of the world today who have been helped by her. And so my experience had been that we have been passionate about caring from ever since, from being a child. Think of it, I'm the third girl of nine children. And so, I mean, I'm the first girl of nine children. And so I had to care. I just had to care. So that has helped me along the way in the caring, nurturing my caring um, instinct or my caring capabilities. And I've been passionate about nursing, as you can understand. Okay. So that with nursing, social worker, those were my two areas of, I would say, areas that I really admired and wanted to be either of one of them. So I have chosen to become a nurse. So over the years, I've been passionate about that, and I'm passionate about caring and sharing. So, and I'm being empathetic. I throw myself in my patient's place and space and try to be of great help to them. And having grown in the nursing profession, I became a nurse educator before retiring. And I served in that capacity for many years, more than seven, I say more than 10 years in that area. And I taught EKG. At first, I recall how challenging that was to me, um, being trained at the University of West Indies Hospital, the nursing. We had to do a year course in critical care, just critical care, not 6 months, but 1 year. We had to do the exams and everything like that. The curriculum was different from other places that I've been. And so I say thumbs up for the training I've received in that institution. Also at West Indies College, now Northern Caribbean. It was a 4-year course, Bachelor of Science in Nursing Education, when I completed many years ago, more than 4 decades. All right. Um, and so I must say that I'm passionate. I'll say that about myself in sharing. And because I want to be resourceful, I must say I created resources in that I'm the author of the book Nurse, the guide to empowering new nurses in the delivery of high quality care to all patients. As you see, I'm a podcaster, and I share episodes with the world. and many have responded in a positive way. And my colleagues, and being a mentor and an educator in nursing has helped me to encourage others and to pay it forward because someone helped me along my journey, my nursing journey. And I'm saying kudos to all those my colleagues, my former students who are now my colleagues also, and just about those lives that I've touched in so many different ways. Whether there was a concept that seemed a little challenging, maybe sometimes even in the EKG, getting that P wave, as identifying those configurations, whether there's a QRS following a P wave or so forth. Those of you who have taught and those of you who have done EKG, basic EKG, I'm not going to the technicalities of it, but you'll notice that why is it so important and why we monitor such cases, why we have such patients, cardiac patients and monitor. Why is it so important? So when it comes to the technicality of that, interpreting simple EKG, you know, it's important. And as we monitor them and as we teach and see the concept and the understanding getting clearer, that does something to my inner soul because I'll be able to participate in helping someone to understand something that to that person might have been complex. And understanding that the patient will receive, the outcome of that patient can be so much better because of the high quality care, the knowledge. There's not a knowledge deficit now. There's a knowledge knowing what can happen and why it's so important to understand and to render the care that such case deserves. And so I am excited that I am a Black nurse as we celebrate Black History Month, and able to share knowledge with everyone, not just color or race or intelligence or whatever um, dimension, or we want to look from it from different angles, that we are able to. And I'm a part of that puzzle. I'm a part of the solution in helping someone to understand a concept so that a care high quality care can be provided because of my input in promoting or perpetuating high quality care to patients. Culturally congruent care, I'm going to come with that part because each person from different culture, from different background, from different norms need to receive individualized care. And so you'll hear me say that all the time. In addition to that, I taught transcultural nursing for some time. And I've met individuals from different cultures, nurses who have taught, and they were able to express in their cultural environment some of the things that they practice, some of the things that they know. And that's what give that extra push to being that individualized care and recovery. Because when one is able to be identified with their culture, it does have a great impact on their recovery. So, my young nurse, I want you to remember that. And how can you get those information? You can research, you can talk to the patient, you can talk to the patient's family, you can go on YouTube, you can look at books, you can different literatures, articles out there. So I would just encourage you as a young nurse to be proactive, advocate for yourself, advocate for your patients. And as we are coming to the end of Black History Month, just remember that your contribution to this healthcare is important, not because you're new, but your freshness, your vitality, whatever you have that you've brought to the table can impact and make a difference. So don't be shy. Come forward with your greatness. You have it within you, and you can explore as you go. There's so many different areas in nursing that requires people like you with your talents, your potentials, your abilities, and success, of course, will be yours, and the patients, and your institution, and the world. Thank you so much for listening. I appreciate you. I'm Dr. Miriam Smith from Empowering You Nurses podcast show YouTuber. In addition, I would like you to subscribe, and you and you and you in the audience today, and share it with someone, because others have mentioned how impactful these tidbits, these jewels, these roses are to them, and helping them to mold and to enhance their nursing journey. So do that. How can you connect with me? Well, on YouTube, it's Miriam Amanda Smith. On podcast, it's Empowering New Nurses. On Instagram, it's Podcast Mir. It's also on Facebook. It's on TikTok, Miriam Smith. So I look forward to hearing from you. I'll be coming up soon this year with some webinars for my young nurses. And those, you'll see me interviewing also some nurses. Last, I introduced Dr. Watson, and she talked about one of the nurses, Dr. James, who has contributed so much to nursing. She passed last year, but we honor her voice in nursing. We honor her integrity in nursing. We honor her contributions in so many different ways, her leadership skills, transformational leader in nursing. Thank you. Thank you. Be great.